Welcome everybody to our webinar today covering the topic of employee wellbeing. My name is Wayne Baker and I'm the CEO of Symmetry HR, and I've been at Symmetry since 2011. Just for those that don't know, Symmetry provides solutions in recruitment and HR for businesses nationally across traditional blue collar sector, in manufacturing and logistics. We're also in the white collar sector, in contact centre and all office and managerial based roles. And finally, we're also in the health sector, working in hospitals and aged care facilities. It's great to have everybody in attendance today. We're looking forward to what the webinar can bring today. Just to give you a bit of a snapshot of what the next 1 hour will bring. We're going to understand what is health and wellbeing. We're going to try and understand why do we monitor health and wellbeing. We're going to try to understand, as you, the employers, what are your obligations as an employer for employee health and wellbeing? And if you do put together and implement a health and wellbeing program, what are the benefits? And finally, we're going to try to understand what the impact of COVID-19 has on the health and wellbeing of our employees. Just a couple of housekeeping matters before I introduce you to Paul Hopcraft. All the questions today are to come through the chat box, including those of a technical nature and of course topic-based questions. There will be a Q&A with myself and Paul after the presentation, where I will be drawing on questions from you, the audience, that you've provided via the chat box. So without any further ado, I'm going to introduce you to you, Paul Hopcraft. Now, Paul is the Managing Director of Work Health Checks and the Preventure Group. Paul's been assisting employers for over 20 years, taking a proactive approach to workplace health and wellbeing by implementing an approach known as the Preventure Program. In recent years, Work Health Checks has been developed as an online health and wellbeing platform for employers to help them improve their people's mental resilience and physical health, which leads to greater engagement. Work Health Checks is the first behaviour change platform as both an organisational risk management tool for employee health and wellbeing, as well as combining data, stories and actionable steps to take individuals on a journey of improved wellbeing and performance. A little bit closer to home, Paul and his amazing Preventure team have helped Symmetry HR be one of the leaders in OHS management and significantly increase the support we provide for all of our 600 staff. Moreover, we have seen firsthand the value of the Work Health Checks products. For those that don't know as well, a little bit about Paul. Paul was a former shareholder of Sausage Software, which was one of the fastest growing tech companies during the dot-com boom of the mid to late 90s. Paul has a passion for permaculture, which for those that don't know is using natural resources to live self-sufficiently. And Paul wants to help as many communities as he can by teaching them techniques on natural resource self-sufficiency. Finally, Paul is part of the Leaders for Change organisation, where he volunteers his time and experience to help communities within the region of the Southern Philippines, where he develops a variety of skill sets and life education for the people there. I welcome Paul Hopcraft. Good morning, Paul. How are you?
Good morning, Wayne. Thank you very much. How are you?
Yeah, not too bad at all. Not
good,
too
good.
bad at
Thanks
all.
for your kind intro there. As always, you're very flattering, Wayne.
Not a problem at all. Hey, it's good
Going
to have
back
you.
a long way too, back to the 90s anyway.
Absolutely.
Yeah, look, good morning, everyone. It's great to be with you, and thanks, Wayne, for that intro again. Thanks for being part of this webinar to talk about what's becoming an increasingly important topic, and that is health and wellbeing of your workforce. I may have even spoken to some of you previously, either as part of Preventure or the Work Health Checks program. So this morning I'll be taking you through some ideas around what monitoring of employee health and wellbeing means, why it's important, and what are some practical steps you can take now to begin implementing an approach. Finally, so that should be done in about 30 minutes, I'd say. Then finally, we'll get into a bit of a Q&A session think Wayne mentioned there's room to sort of type in some questions if you like to, and then we'll do a bit of a wrap up. All right, so I'll start with a quote here. In these extraordinary times of uncertainty, anxiety and stress, taking care of your well-being is more important than ever. So it goes without saying that we're in a unique time in history and in the workplace today. Employee health and well-being is becoming a much greater focus than what I've ever seen it before. I've been in this space for about 20 years. It's always been a bit tough. I mean, my focus has been prevention and getting on top of things early, and that's always been a bit of a tough push. But I guess since COVID's come along, we've all had to adapt our businesses, change the way we do things. And that's led many of you to think about health in perhaps new ways, with the need to sort of introduce measures such as, you know, working from home. We've got the social distancing, just to continue our businesses operating effectively. And this in itself has raised new health concerns, which we think will have long-term consequences for employees, such as things like working from home, increased anxiety, the stress of isolation, lack of job security. I've never seen such a big, I mean, none of us have seen anything like this. I remember going through the GFC in 2008, and that was a big fallout, you know, a lot of uncertainty around that. But the feedback we're getting so far is, it's quite overwhelming. A lot of employees, a lot of you out there, you've had to move quick. You've had to adapt these new ways of thinking. You've had to deal with things like, you know, the JobKeeper program and setting up people from home. So it's really challenging times. So I want to try and give you some thoughts today, and certainly beyond today, even if any of you would like to have any discussions around whether you're doing the right things or doing enough, or you want to do more, then we can arrange those discussions. At the same time, I wanted to offer some hope that there is light at the end of the tunnel, and there is also a very, very big payoff for employers that adopt these new approaches to health and wellbeing now, in terms of that increased productivity, things like reduced absence and a greater improvement in the overall health of the workforce. I've been out to, look, literally hundreds and hundreds of organisations over the years, and whilst a lot are wanting to do more in this space, I think this whole COVID thing has just fast-tracked now the need to be doing more. So current health and wellbeing initiatives. So before I get started, I just want to briefly talk about the current status of health and wellbeing in the workplace and some of the challenges that you may be facing. As I'd mentioned, we're in constant contact with you know, businesses across all industries. So it's given us a unique perspective on how various employers are approaching health and wellbeing. It's obviously different for different industries, but we've found that a lot of companies have had a go at putting in programs, but few have really done it all that well. So it's been a bit tough for a lot of employers out there. Just having some trouble here with my screen, it's all right. We'll go to the next slide, Gareth. Slight technical difficulty. What's happening here? All right, so why monitor employee health? So clearly there's a clear legal requirement to monitor employee health, and there's probably not enough understanding what it actually means. So we've got to ensure people are free of risk of injury, whether that's physical or mental health, and maintain a safe working environment. Now, I can feel it's becoming more about people now, so not so much about the physical aspects of OHS, but more about the the human side. And whilst the various OHS acts around Australia are focusing a lot on the physical aspects, it's there is policy and there is a move towards more of the human side. So, and that's where most of workers' compensation claims are coming on from, for example, right now. So not only do we have that legal obligation, but also believe that we have the moral one, and that can lead to greater level of engagement with the workforce. And of course, by picking up on things a lot earlier, you can reduce those employee health risk factors quite significantly. So for me, we're probably left out the H in OHS for a long time. And with COVID-19, I think that employee health has now come to the fore. And particularly for you guys, a lot of you, I guess, are from involved in HR and health and safety and health and wellbeing. And your guys' roles now has really come to the fore. And I think everyone's now trying to work out what it means and how we can also support our employees much better. The other thing that I guess is happening is that there's a lot more people working from home, and that's also created its own concerns. And I mean, I would be getting like a dozen calls a day from employers, I guess, at the moment on average, or the organisation. And for a lot of you out there, it's when you do have people working from home, it's about this uncertainty of, are we overloading them with information? How's their mental health? We know there's more drinking going on at home anecdotally. There's things like the isolation. Some people are not suited to working from home. Some people are just frustrated by the whole thing. So yeah, so it's certainly some challenges right now. The next slide, what are my obligations? So we've got three main obligations, and I like to bring all these three together. We've got the legal, moral, financial. Now, certainly in the prevention program, when we were running that, which was a management training program for employers, this was a real key focus, that some organisations were doing the legal bit only, some were doing the financial bit only, some were doing the moral bit only. But if you think about it and you start to consider all of those three, legally, we've got to do the right thing. Morally, we've got to do the right thing. And financially, business is about reducing costs, absence, sick days, and presenteeism. So it's important that we address those things together. All right. All right, I have a slide there. Organisations that implement health assessment can reduce their employee health risk factors by up to 56% there. We did a survey out of 1,200 employers last year, and it's interesting that majority of employers put people first, but not many really had systems in place when it came to dealing with workforce health. As I said, I was going out to, before COVID, to a lot of those organisations. I remember one example, there's a big manufacturer down in Colac, actually. I hope no Colac is here, but the CEO, I was walking around with the CEO, and he was pretty tough, but we were talking about people's health, and he didn't seem all that interested. But I did point out a machine. I said, what happens if this machine breaks down? And he said, oh, that's easy. We've got all these systems and procedures in place. And I turned around to him. I wasn't trying to set him up, but basically I said, well, what happens if a person breaks down? And yeah, he didn't really have an answer for that. So that wasn't, it sort of sent a message to him, I think, anyway. All right, the impact of COVID-19. So can't go without a webinar in this time without talking about that, but it's quite a telling comment that, you know, where we're at now is that since Feb, the workplace has changed very, very dramatically with the pandemic. We've never faced this before. It's been difficult for areas of business. As I'd mentioned, for you guys in HR, dealing with standing down people, having people working from home, communicating with the staff, the job keeper program, PPE, it's been tough. And I can really sympathise that even in our business, we've had to, I'm working from home. Yeah, so it's not easy. And most companies have had groups of people working from home. I think there's now movements to try and transition back, but obviously in the future that people will stay at home, stay working from home. And one of those things we're starting to think about now is about performance and health and wellbeing when people do come back. All right, the Work Health Check survey. So last year we conducted a nationwide survey. It was around about 1,200 employers, and that was across most industries. This was done in conjunction with the Monash Centre for Occupational Environmental Health and the Preventure Group, my other business. So what we did, we had a survey prepared around various categories. Mental health was included as a major component of that because that seemed to be high on the agenda. The employers completed that, and we got like a very good database out of that as to where they're at, what the initiatives are, and we developed some key learnings out of that also. We'd done a similar survey back in 2014, and looking at the comparisons, it's clear that there is a lot of you doing a lot more work now, but that understanding of what is health and wellbeing, what does it mean for your organisation, what is the plan, there's still some learnings there that need to be put into place. I have here the cost that was developed by the Australian Industry Group. Cost there at $79 billion. So if we look at that recent survey, $578 per employee per absent day, and counting the direct costs alone, the annual cost to the economy is about $44 billion. If we add on top of that the cost of presenteeism, which is a bit of a nebulous term, but basically someone who's at work not productive or unwell, totaling that up, that's around $79 billion. Obviously, that's a very, very big number. And I suspect when we look back on 2020, that's going to be a much larger number. So the key learnings now, clearly there's an opportunity for employers to do a lot more, and these are the four learnings. Number one, organisations should consider ways to support the health of their workforce. So when we were asking employers about what they were doing, there was a lot of things around like employee healthy eating programs, for example, is a good example, or smoking cessation. And I think a lot of those initiatives were, there's some feel-good initiatives, but we know that in order to, there is an obligation to mitigate or minimise risk, which is part of what we're talking about in the workplace. And I think those two have been quite disparate in terms of the separateness between pure employee feel-good health and well-being and the health and well-being as a risk mitigation strategy. And certainly the discussions with a lot of you out there have revolved around each end of those scales and how we sort of bring it, if that makes sense, into a sort of a nice middle space there. Key learning number two, employers should do more when it comes to supporting the health and wellbeing. So we need to get the buy-in from the employees. We need to, some employers are attempting to, for example, to force things on their workforce, particularly at this time. I think you've got to be very careful about how you go about implementing such a program. At one end, again, you've got sort of that you must do this program. At the other end is perhaps running it as an employee opt-in system. I think personally, highlighting the benefits to the employees of being part of a program, generally we've found that's been clearly the best way to put in place a program, is to sell the employees on the benefits and make sure that they are getting feedback. I think that's been the critical point. We could almost graph the organisations that were not giving feedback tended to have these programs drop off, but the ones that did give the feedback and got that real consultative approach tended to have long-lasting benefits. Key learning number 3 is the senior management support. This has always been a tough one. Most of my discussions have been with HR, and we're normally getting senior managers of the business involved. As I said, it's been a bit of a tough one to sell in the past, not so much these days when we've now got this focus on other areas and people's health and mental health. But if there is a lack of senior management support, it can prevent you from establishing a full program that's going to demonstrate the benefits. So we're going to get those other leaders involved. We've got to be able to explain the benefits for them. We've got to be able to show a bottom line impact. I mean, even things like if we look at those previous costs of absence and the presenteeism, even in workers' compensation costs, I mean, for a 100 staff company, one claim could be costing you $100,000 a year for 3 years. So we think obviously by moving on to sort of the front foot with this type of approach will reduce those costs. And key learning number 4, which really leads into these costs. So by the time you factor in turnover, the absenteeism, presenteeism, injuries, and I guess general employee morale, engagement, their energy levels, not having a way of monitoring and managing the health of a workforce can be very costly. Just by the way, when I say the word monitor, I think I probably like something like supporting. I mean, what we're all about, I have this genuine attempt that I was already part of seeing a lot of workers' compensation cases that had gone wrong, that had become very, very expensive, and where the relationship was broken from the employer. I know that most of those were avoidable, despite I've had CEOs tell me they weren't avoidable, but they are, and most things are preventable. I used to go out and run workshops with managers around the table, and it was almost the same script, and I've done it over maybe over 500 times now too, from employers of 10,000 down to 20-person businesses. But as I said, it's always the same type of script. So if I ask those managers around the table, I say, how are your workforce? They'd say, oh, well, look, everything's fine. If I ask each manager then a few more pointed questions, almost without fail, everyone could pick up on someone who was at risk, as I call it, or someone in that 10% profile of any business. So if you've got 100 people, 10 are in that at-risk category, where there's perhaps something going on at home, particularly these days, psychosocial things, the drugs, alcohol, substance, bullying, job performance, right fit for the job. And just going back to that and speaking to those managers, they could always identify a person in that category. Then I'd ask, so what are you doing about it? And in almost all cases, they'd say, well, nothing. There's nothing you can do about it. And I would argue the case that's not the answer. The answer is that there's a lot that can be done. You can have these courageous conversations with people, and you can stop those things from occurring, or at least minimise or nip them in the bud before things get away. So I just want to emphasise that point today, that most things are preventable. I could debate that with anyone now, and if there was something that complex that had happened and I'd had a manager take me up on that, I would track back and track back and track back. And normally by the time we got back to it, we could get to a root cause. And that root cause was around some of those factors that perhaps that person's manager was aware of, but nothing was being done about it because they didn't really have the tools to have those conversations and manage that through. So I probably went on a little bit about that, but it's an important point to me. So next one, leading into a risk management approach to employee health. The survey that we did and the data we collected has led us out of that to address the main gap in the marketplace right now. And that is this emerging area of health and wellbeing as a risk mitigation approach. So I mentioned that any employer, any of you out there now in your workforce, there are 10% of people who fit this at-risk profile category. And that's not, I'm not trying to paint this as a negative connotation. It's just the fact that they're there, and we need to do more to support that 10%. When I mentioned in terms of the actual health and wellbeing programs out there, a lot of them are piecemeal, they're ad hoc, there isn't real planning. So the impact of doing it that way, I guess, it really means that there's clearly a more structured approach is needed, which involves measuring the health and wellbeing of workforce, and then setting goals and then measuring improvements. So we've got to understand, I mean, we see a lot of employers that are doing these things, but they don't really have an understanding of the health of your workforce. So if you ask yourself that question now, do you know where your people are at? Do you know the status of their physical and mental health? If you think about it, some employers do, let's say, a pre-employment check when someone starts in the business. But then once that's done, that's pretty much it. It's set and forget. Now, we know, and particularly these days, people's life circumstances change from month to month, from time to time, but yet we're not really doing anything beyond that pre-employment check. So I think just like equipment needs maintenance, we need some way of having an ongoing discussion with our staff around where they're at. I've seen there's been talk around, particularly with mental health and Beyond Blue, where it's, you know, asking someone, are you okay? I don't think that really goes far enough. And I don't think for a lot of managers, they're uncomfortable in having that conversation. So they don't know quite what to do. I'm in the middle of one of these at the moment with a client up in Albury Wodonga, actually. And I had one of these discussions over a Zoom conference when we were talking about mental health, and it got quite heavy. But after the presentation, the CEO rang me back and said one of the key managers in that meeting, he suspects has got some real mental health issues going on, and he didn't know how to approach it. And he said that conversation actually opened it up. So it's one of the best things we can do to start to measure things and then start to be able to plan and put in some steps and have those conversations. All right, health and wellbeing as a risk mitigation strategy. So when I say that most companies aren't really doing anything beyond those pre-employments, that means we're all kind of playing a game of hope. I hope people are okay. I hope we don't have a problem. I hope the mental health of my staff is okay. I hope I don't have a workers' comp claim. With the prevention business, we got involved at that end where things had gone wrong and things were getting complex, and we oversaw around 3,000 cases. And as I mentioned before, I know most of those were preventable. Most of those didn't need to get where the relationship had broken down. So certainly I was always trying to push earlier into the process where we could train managers on picking up on those things early and then start to deal with things before they become a problem. Of course, there are things like injuries which do happen, which can be unforeseen. However, I say around about 80%, you can really start to pick up on things early, and that blocks 80% exposure on those things like the absence and workers' compensation. Okay, let's get into perhaps how to monitor the health and wellbeing of your employees there. So from those key learnings, we found that the main gap was that I said before, like the tools to directly support the health of the workforce. There's not much out there. Or we think the Work Health Checks program is sort of moving towards where things should be, and our range of assessments certainly do that for employers and give them that benchmark and the dashboard and the tools for a starting point. But that first one there, setting the objectives and the goals, that's critical. Work out what you want out of a health and wellbeing program and decide what it is to you. I went out to one employer that was a hospital with 1,200 people, and they convinced me they had health and wellbeing under control. And what they actually had was a fruit bowl in the canteen, which is not health and wellbeing. It's a good start, but it doesn't go far enough, obviously. Getting that support from senior management, we briefly discussed the importance of having that buy-in. So you need to demonstrate plans and the paybacks and the benefits that will be achieved out of it. I would suggest having a 12-month plan. Using the technology and the tools, that's where things like the Work Health Checks online self-assessment comes in. There's many tools out there now. There's all sorts of different software as a service models that you can take up for very small dollars and give access to your staff. One of the things you need to consider is privacy, security. That is something that's coming up a lot with our clients now, that they need to be sure that any of these answers into assessments are confidential. And certainly we've spent 6 months on working on that particular component, developing our Work Health Checks program to the APRA standards, having anonymised data and ensuring that absolute bulletproof, any medical information provided by an employee is kept confidential for them only. But you as an organisation get a view of where the bigger picture is at. This is a bit of a grey area, but again, I'm happy to discuss this one with anyone beyond this presentation. Just a quick example there. There's the employee dashboard. So we had our clients come back, and one of the things that they wanted going back a few years ago was a dashboard to give a picture of where the health of their workforce is at. Obviously, you can manage what you can measure. So this is based on a global RAND standard, that's R-A-N-D, which is a global standard for employee health and wellbeing. It consists of 31 questions. We now have that in what we're calling a general health and wellbeing check. And this is a way where you can actually get the measure of where your employees are at, and then start to set some targets and start to track that improvement. We also have a running line graph of the overall picture, so you can pretty much track along a 12-month picture plan as to where you're tracking. And all of that is done on a preventative basis. Now, also, once you start to see these pictures, I should mention that can start to help get you an idea of where you can put in some interventions and design some ongoing services after that. Some of you out there have got things in place like EAP providers, employee assistance programs. And again, something like Work Health Checks and the dashboard can be we've found to be a good piece in the middle to help support both the providers and the employer in understanding where the major pain points are in the business. Just a quick case study. This was for an aged care group which has 10 facilities. I won't actually mention their name because they did actually have a COVID outbreak. Obviously that's confidential, but these were some of the numbers that we had done going back about 8 months ago out of a pilot program. So you can see there, 55% had lower back pain. There was that sort of back, neck, shoulder pain, and the level of anxiety was increasing over time. Actually, in the last 3 or 4 months, we actually did an update on that. Was that anxiety had gone up to, I think it was 37%. So in that industry, clearly that's a real issue right now. Health and aged care is under a lot of pressure. So yeah, it's a tough one. Finally, some takeaway points from today. Engagement, reduce risk profile in the business. It's more important than ever right now to be doing something. Now is the time to do it. We were moving towards policy which was stepping up the role of employers and employee health and wellbeing, the role of mitigating risk. I think for COVID now has just fast tracked that, and that will continue. That's my feeling. There are obviously big paybacks if it's all done correctly. Over time, you can now measure and track that and set those in place. I mentioned the COVID-19 impact, particularly in mental health and people working from home. So that's something that we're all going to need to keep working on and keep on top of. The legal, moral and financial obligations to consider, and then when you're making decisions, try to make sure you bring those three together, and you really can't go wrong. Setting those targets, the measures, tracking the trends, and then applying interventions. So those sort of steps. And the long line, if we're looking at risk, a risk management approach to employee health, which is probably new to you, but think of it like risk management applied to occupational health and safety, where you would assess your risk and then you put in controls and monitor along the way. It's just that we can now do that for people, and we should be. Point 6 there, giving the feedback to employees, incredibly important. I mentioned getting them involved, perhaps getting a small team as to what they want out of it, ensuring that you're respecting their privacy and confidentiality, and give them feedback along the way. With our Work Health Checks product, we do give confidential content back to employees. So if they do an assessment, someone identified as some elevated anxiety, that would be then tailored so that that employee gets their own low-key content on perhaps that area, and what some of the steps they could be doing themselves, but that is completely confidential to them. Finally, obviously prevention is better than cure. So that's my whole push. My whole push with the prevention business was trying to get employers to think in terms of being proactive, get on the front foot, practice prevention. Work Health Checks is now taking that another step further. So we're pushing far up into these the early stages as possible, but as a way of that ongoing and continual support of staff, supporting their mental resilience, their physical health. And I think if you get those two right, leading to greater engagement in the business. So with that, I think I'll now hand over to questions, and Wayne can come back on.
Thank you, Paul. Another really good presentation there, and there's a lot of juicy information for people to digest. I want to, as a message to the audience, which is really important, Paul is offering a free one-on-one demonstration of the Work Health Checks platform and product. So if you would like a demo, please just go into the chat box now and type demo. So I'll just repeat that. If you are looking for a sort of like a free one-on-one walkthrough of the Work Health Checks product, please go to the chat box now and type demo. On that note, Paul, I just got a couple of questions and that I want to drag from the audience, of course. Yeah. But at the same time, Paul, I'll probably kick things off. So how does one or an organisation go about rolling out the Work Health Checks? For example, are the checks compulsory? What sort of advice would you give to the audience out there around rolling it out in the beginning and getting it started?
Yeah, look, I mean, it's a good question, and it's normally the first one that comes up. When I mentioned before that it's been tough for employers to know what is that starting point. But I think in terms of rolling out such an approach, I mean, it does depend on your industry. So when I said before, you've got, for example, a mining company is the focus is on real OHS and mitigating risk, and that's more where you can kind of roll it out as a mandatory program. At the other end, we've got clients who are in white collar, finance business, where they're wanting to run it as a pure health and wellbeing portal for almost like an employee benefits program. And that's fine either way. For most of the companies I'm speaking to, they want to do it somewhere in the middle. So we're in a time where I mean, we've worked with Department of Health, we've worked with the Work Safe guidelines, Safe Work Australia. So we're on top of that. We're adapting our system to meet those requirements. And by doing that, that's given us sort of this, heads up on where things are at so we can adapt our system. But we would onboard you through rolling out a program and have a discussion with you. There's no cost for that. The checks themselves are only $3 each per person, so it's a nothing. The cost is a no-brainer. But we're happy to discuss that rollout, to discuss what suits you. Maybe you get a small team together, and we've got a lot of best practices now. So whatever industry you're in, we can sort of relay from another client who's done it well and kind of feed that to you and get you started that way. So I'm not sure if that answers it, Wayne, in terms of being compulsory. I like to think of it as a positive opt-in system. And we've found if it's done correctly, generally, the uptake increases over a couple of months. People see that they're getting something out of it, they're part of it, and they want to be part of it. Because let's face it, most people, particularly guys, Wayne, they don't really, I don't think they do much in terms of managing their own health so well. So we've had feedback from organisations where the employers come up and said, I didn't know I had a, believe it or not, drinking problem, or we had one guy who was limping at the end of the day. It turns out he had gout. It all came to the fore. They had a discussion about it, and they're helping him through those next steps. So,
okay, thank you. That's good. Just a couple of questions starting to flow through the chat box now. And next one up is, how do you approach or mitigate risk when people's employment checks identify mental health issues? It's a really good question.
You mean if they've done a check and it's been identified, there's a mental health, is that what you're saying?
Yes.
Yep. Yeah, look, it needs a fuller discussion, and it's on an individual basis too. It's sort of a case by case thing, but in general, I hope I answered this correctly, but in general, if someone has identified that there's a mental health concern, there's a responsibility on the employer and the employee to ensure that everyone's well for work under the broader OHS acts around Australia. So in our dashboard, we would have a scoring system whereby someone may come back on that standard K-10 mental health score as a high score. That then needs a discussion. Now, I would need to discuss further perhaps how you get into that discussion. There are various ways of how that would be run. And that depends also on when you've run this as an opt-in system or you've run it as a sort of a mandated program, which is part of the process of around the employer policy, for example, Wayne. So all I'll say is if there is a mental health concern, there is an obligation on both parties to do something about it. Once you're aware of it, you should do something about it. And then interventions can happen from there. So that could be EAP, it could be offering some further assistance through the GP, through the psychologist, for example. It is grey and it's a tough one, but certainly the clients we're working with have overcome that, Wayne.
Okay.
I'll just follow up to it. It does open up what I call that. Often it is that courageous conversation, like I said before, opening up that, not just how you're going, but those next steps. And possibly you've already noticed something with the person, which does give you that in to say, look, I'm concerned.
Yeah, look, it's interesting in the chat box. Shane Medcraft, one of our attendees today.
Yeah, I know Shane well. Hi, Shane.
Yeah, thanks for the question, Shane. Really appreciate it. Shane did make a really good pertinent point there, the difference between a courageous conversation and a tough conversation. So yeah. I'm glad you covered that. So just in relation to the assessments, there's a couple of queries coming through in relation to how flexible are the assessments and how flexible are the questions within the assessments? Is like at a standard template that you roll out with the employees with the work health checks, or is it flexible enough to sort of include more contextual
Yeah.
questions that are based specific to that company or industry.
Yeah, I know what you mean. We've got 10 standard health assessments we think we've put together from over 20 years, the best of the best in terms of a pre-employment self-assessment and an exit assessment, which is still just $3. And in between, there's preventative, there's mental health, stress, etc. Now, we've developed in the last 6 months the COVID screening check. We've developed a risk assessment check for industries like aged care that are required to identify someone who fits an at-risk profile with age and a pre-existing condition, for example. But we are finding, as I think you're setting contextually, that some employers want to put their own questions in. And again, we will do that. We will tailor an assessment and we'll include things. We've got some clients that got everyone working from home at the moment. So we're including a type of working from home checklist, which they can just update each month. Again, you've got employers who have done the checks at home in setting up the person with their ventilation and the screen height and the chair, but then there's nothing following that up. So, you need to have that ongoing monitoring, or that ongoing support, I think, is critical. But certainly in terms of flexibility, we're happy to accommodate the needs of the employer. And normally in that first onboarding discussion, Wayne, those specifics come up. Some are happy with just the standard, but the more you sort of tailor it to the organisation, the more they're going to get out of it.
Yeah, good.
Yeah.
Look, we've got some really good questions coming through. Heather Gilbertson, thank you, Heather. A really, really good question here, Paul, which I think will speak to many in the audience today. Heather says that her department has significantly reduced, the morale significantly reduced in the last 2 weeks, with the team split between half working at home and half working on site, and it sort of alternates each week.
Yeah.
And she's trying to implement some strategies on keeping the team connected socially during isolation. So I was just wondering, any suggestions from yourself around employers that you've been speaking to on how they've been managing that half-half type of arrangement?
Yeah, look, I think it's been tough, of course. And, anything that's been sprung on us so quickly, we've needed to adapt to that. Of course, the pressure is on then in the HR department who, to manage this, which it's tough. So in terms of people working from home, I mean, I had a discussion with company, I think it was on Monday, and the guy pointed out to me, a HR manager, and said, the thing is, we know some of our people are suited to working from home, but some are not. Some just are not coping with it. Some are. And I think you need to start to look at that in your teams too. We've been doing some work around that, around identifying, for example, someone who's autonomous, who is disciplined and won't end up sitting on the lounge watching Ellen DeGeneres show or something. DeGeneres, not degenerate.
Degenerate.
Yeah, that's right. But so I'd say that's some sort of a starting point. And again, we've done that with teams where we've put together an assessment. We've identified a bit of a profile and had the employees complete that, and then come back with a picture for the employer to say, well, here's where your teams are at, here's how they're feeling. Because probably right now it's anecdotal. The lady that asked the question, she's getting some sort of feedback, morale's low, but I'll just emphasise, just having this data and having some structured format for that, Wayne, gives you a really good starting point to then start to make good decisions in interventions.
Okay. We've got a question here from Michael Falele. And Michael, thank you very much for the question. Again, it's great having you. Michael says that, how do we approach getting professional mental health for a staff member if we have established there is a problem? For example, one staff has been trying to get an appointment for 3 months and the next available appointment is 6 months away. What sort of advice would you give there?
Well, look, we've got through the prevention business, for example, we establish a network of psychologists and, rehab providers and GPs that we worked with. And we have been asked to assist with the work health checks clients in interventions if something's been identified. So yes, we help the employer to work through some of those questions about how to identify, then what to do. I don't want to get too involved in the, providing that service as an ongoing, but what we are doing is happy to refer on to employers some resources that could help with those next steps. And again, that's got to be in context. It depends on the situation. Sometimes it's at an organisational level, Wayne, where you'll get someone in and, they'll talk to the teams and talk about these times. And, so there's always an answer. There's always that next step, but the person's also got to want to help themselves, Wayne. There's always a bit of that too. This is where it all gets a bit grey, but clearly once you start having these discussions, you do flesh out a solution. That's what I will say. Yeah. Okay. And certainly I'm happy to provide resources if this guy's
if they're short in a particular area, which I think is where Michael's coming from. Just look, a really good question here from Summit Malahan. Summit, thank you again for the question. Great having you, and I hope you're enjoying it. The question is, can you please elaborate on the COVID health check, specifically from a frequency perspective? And it's a really apt question for even myself, given we Symmetry use the product and we've got a frequency going at the moment. Paul, what do you think is around frequency, and a little bit about the COVID health check? Yeah,
so the COVID, that's changed over time, and that's changing with the with where the Department of Health guidelines. But we have a number of employers who are doing that daily. For example, in aged care, we've even got some manufacturing employers who are doing a daily check, and this is more along the lines of the compliance path. So it's important to track and have a history of that. We're sort of not into the sort of the track and trace thing, but more just having that history established. Some are doing it fortnightly, which is an incubation period. Some are doing it monthly, just to sort of keep things on track and keep that monitoring of the screening checks going. But I can't remember the specific questions right now, but at the moment, I think there's just 6 questions. And we haven't had an issue with employees. They can just be texted that, as we do with Symmetry. They just get a text sent out. They just go tick, 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 and then it's logged and it's tracked. I have spoken to quite a few companies where they're trying to do this manually with Excel sheets and paper forms and things, and it's a nightmare, because this thing may go on. It may switch off and then switch back on over the next couple of years. We just don't know. So certainly, and Wayne, just briefly, in some of those screening checks, we're also adding some additional questions. Okay. So, like tacked on at the end, is everything okay? Have they had any incidents at work? We've got a truck driving company doing that now, and several others who have just sort of adapted their own versions of it. But so
it's
that's
a great way to engage and build relationships, Paul, isn't it? It's got multifaceted sort of platform. A good question coming through here, Paul, is from one of our audience members, Gareth, saying, given privacy issues, how do we know which staff member has which issue if we only see the dashboard? How would you answer?
Yeah, there is a drill down option, and this is also comes back to the rollout of the program. So the rollout, I mean, if we've got this obligation to minimise risk in the workplace, and again, this is something I'm happy to help any employer with, but we got some, I guess, industrial relations comments on this from IR lawyers, for example. Now, if you, as your role is to minimise risk in the workplace, if you went into print and said, look, we want to minimise risk in our environment, whether that's physical or mental health, and both should be covered. To do that, you really need to know where your workforce is at, and that gives them the impetus or the right or the mandate to say, look, here's just a low-key, confidential, secure, respecting your privacy self-assessment system. You can offer it as an opt-in, and you may only get 50% doing it, but that's enough to give you a picture of where things are at. Does that sort of cover that, Wayne? I'm not sure.
Yeah,
if I
no,
covered.
absolutely, absolutely.
Yeah.
We're starting to come towards the hour, and I'm very mindful of time here, Paul. And there's some important things that I'd like to finish on. Just keep in mind, guys, that out in the audience there, for all questions that were not directly addressed from the chat box during the live webinar, you will receive a response post the webinar today. So look, what I want to do now is, first of all, I really want to give out a massive thank you to Paul Hopcraft. Paul, thank you so much for today.
Thanks, Wayne.
It's been amazing. You've offered it some really great information, education for everybody out there on how to embark on employee wellbeing and monitoring and tracking it. Again, as a reminder, Paul is offering a free walkthrough of the one-on-one demonstration. So all you need to do in order to access that is type demo in the chat box, which I can see quite a few people have done that already, which is really encouraging. So just a reminder there. I also want to thank the live audience today. Thank you everybody for joining us. It's been a great way to spend our Friday mornings. You will be receiving a Symmetry gift pack for being present today, which does include the following: recording of the webinar, obviously sent directly to you via email, 5 free work COVID-19 health checks for you to utilise on some of your staff members. There will be some recruitment discount vouchers sent to you by Symmetry HR. You will also be receiving a employee wellbeing white paper, which will be sent to you. And of course, as I've already discussed, a free demo of the work health checks platform by Paul Hopcraft. Yeah. So what I want to do is, as I said, that will be sent out to you via email preceding the webinar today. I do want to thank everybody for their attendance. I want to thank everybody for joining us, and enjoy your Fridays, everybody. Enjoy your weekends, and please stay safe. Thank you, guys.
Thank you. Thanks, Wayne.